Greetings everyone. It's an honour for me to be receiving this very first Women's Health Rights Award from Women's Health Action today. Women's Health Action has done vital work in New Zealand since it was established in 1984 to support women to take claims for damage done to them by the Dulcon Shield intrauterine device. I will recall Women's Health Action's role in bringing our country's attention to that unfortunate experiment, quote unquote, at National Women's Hospital in Auckland. One of the lasting legacies of your advocacy was the establishment of the National Cervical Screening Program, following the recommendation of the Cartwright Commission. It fell to me as a young Minister of Health in 1989 and 1990 to begin the establishment of that program. And it's given me a lot of satisfaction to see mortality from cervical cancer drop as a result. But there's still a way to go to achieve equal health outcomes in this area across New Zealand society. I also introduced to Parliament the legislation to set up a Health Commissioner to ensure that New Zealanders could seek justice where they believed our health services have wronged them. I took great pride too in taking the Nurses Amendment Act through Parliament in 1990 to establish midwifery as an independent profession with direct entry education. And also in creating the area health boards, which for the first time in New Zealand enabled the holistic management of the whole spectrum of health services. Throughout my life, I've been an advocate for the sexual and reproductive health and rights of women. I've always supported a woman's right to choose on abortion. I support universal access to family planning. These issues remain highly relevant in my present role as UNDP Administrator. For women to enjoy full gender equality, they just have to have the right to determine whether or not to have children and the timing and the spacing of the children they choose to have. This year the world celebrates the 20th anniversary of the 1994 Cairo Conference on Population and Development. It recognised reproductive health and rights, along with women's empowerment and gender equality, as essential for making progress on development. Women's reproductive health needs, though, are still underserved globally. Many women lack access to services, and mortality rates among women in pregnancy and childbirth remain high in many countries. It's rather sad to note that the Millennium Development Goal aimed at reducing those rates has been one of the slowest to make progress. The record of women's health action in New Zealand shows how vital the role of civil society is in holding the health professions and the health services and governments to account. You have a lot to be proud of on your 30th anniversary, and I'm proud to receive this award at this time and on Women's Suffrage Day. Many thanks once again.